Welcome to Docs on Call, brought to you by Methodist Medical Center, with your host, Gina Morse.
Good evening, and thanks for joining us. Tonight's topic is vascular disease. That's the general term for a variety of problems affecting blood flow throughout the body's blood vessels. The causes of arterial diseases can be wide-ranging. Vascular disorders include aortic disease, carotid artery disease, and stroke, renal disease, blood clots, even varicose veins. Physicians say the vascular patient is one of the most difficult patients to treat because the disease involves multiple systems of the body. Vascular surgeons coordinate the services of internists, radiologists, and specialists in cardiovascular diseases and neurology to provide complete peripheral vascular care for the patient. So, tonight, it is a complex topic, that's for sure, one that we will tackle with the help of our two local experts. Taking your calls this evening are Dr. James Williams of Cardiac, Thoracic, and Endovascular Therapy, and Dr. Scott Reid of Mid-Illini Surgical Associates, and they're part of the Methodist Medical Center team. Doctors, good evening and welcome. We're glad you're here tonight. Viewers at home, please remember to dial 698-3742 to ask your questions about vascular surgery. Again, that's 698-3742. Let's start by maybe broadening a little bit. I talked about blood flow. That's really what all of this is about. But if we're going to narrow in a little bit on what that means to our overall health, what are some things that we should be looking out for to make sure that our vascular health is intact?
I think that it's important to first sort of be in touch with how you feel, with what you do every day, and just simple things like, do you have pain in your legs when you walk? Do your feet feel numb? Do you have sores that don't heal very quickly? Things like that.
And that's all connected to our vascular health.
Absolutely.
And what do those things tell you, Dr. Reid?
Well, it's funny because a lot of these patients think it's just part of the natural aging process when they really have significant vascular disease. So some of them may be diabetic, some of them may just think, well, I'm just not supposed to be able to walk as much as I should, or I've got a cut or sore that won't heal, and well, I'm getting older and I'm not really doing as well as I would if I were younger. And a lot of times this can really be kind of the tip of the iceberg. And so it's real intuitive to try and have these patients keep an eye on, are you having difficulty walking? And it's funny because a lot of times, even from a walking standpoint, we tend to kind of think of it as a pain issue. And yet I find patients who routinely will come into the office and, no, I don't get pain when I walk, but you say to them, well, how far can you walk? And they'll say, I walk 50 feet. You're not getting pain? No, I don't get any pain, but I get cramping, I get weakness, I get aching, and it's all significant vascular disease that is very treatable.
They just chalk it up to aging, and you want to make sure that they don't get comfortable with that thought, that there might be some real ways that you can treat these issues early on when you catch them early.
There's no question that to be able to catch this early and treat it early is clearly in the patient's best interest. I'd like to sort of reiterate what Scott said. We tend to use the term pain. Maybe a better term would be discomfort. Do you have fatigue or things that keep you from doing what you normally like to do? One thing that we might talk about a little bit later is that a lot of the obstructions cause disease processes that may not have any symptoms until they happen.
All right, and we will get into that a little more later. First, we've got our first caller, and we want to take that call from Iris. Iris, you are live with Docs on Call. What's your question?
Hello. I was recently diagnosed with diabetes, and I now have numbness in my feet. I was wondering, could you explain the numbness, and will I have this forever, or will it get better in time?
What do you think? Will her numbness and tingling be reversed?
It really kind of depends on what's causing it, from the standpoint that, unfortunately, a lot of diabetics do get what we call peripheral neuropathy, which is where they do get pain or numbness related specifically to their diabetes. And if it's related to the diabetes, there are some things that can be done to help manage it, but it's not really a correctable scenario. Unfortunately, there are a lot of diabetics who also are at a high risk of developing peripheral vascular disease. And so part of that issue can be trying to say, is your discomfort, is your numbness coming from your diabetes, or is it coming from a severe peripheral vascular disease issue? So generally in that setting, what we'd recommend is to get in with your primary care provider. And there are some very basic things that they can look for on your physical exam. Do you have pulses in your feet? Do you have any skin changes in the feet? That can help from that standpoint to say, is this a diabetes issue, which would lead down one treatment path versus is it a peripheral vascular disease issue?
Okay. All right. We have another caller. Kathy has a question for us. Kathy, you're live with Docs on Call. What's your question?
Well, I had 3 brain aneurysms clipped back in November, and I'm wondering if that puts me at a higher risk for having other kinds of vascular problems in other parts of the body.
Good question. What do you guys think?
Well, it is a very good question, one that I get pretty frequently. I don't really know of any association between brain aneurysms and aneurysms in the other parts of the body. However, if you have aneurysms in the other parts of the body, for example, your abdominal aorta behind your knee or in your chest, you can have association of aneurysms in the other parts of your body exclusive of the brain. I think that it's important to point out the fact, though, that aneurysms in all parts of the body frequently don't cause symptoms. They have to be found. Incidentally, they're frequently found because other studies are done, X-rays are done, or some other illness causes them to be notified, to be observed.
Agreed.
Okay. We have another caller, and this one is from Chris. Chris, you are live with Docs on Call. What's your question?
What do I do for extreme edema? I had hip surgery recently, back in November, and I have to have another one done, complete hip surgery, and I have extreme edema and taking Lasix at this point.
All right.
It's somewhat, it can be a little bit of a challenge, especially after hip surgery, and depending on what's set it off. There are some patients who develop what we call lymphedema, which is really not a correctable type of swelling. It's more a matter of managing it. And certainly you're on the Lasix already, which is a good idea. Elevating the leg as much as possible. The other thing that you could probably talk with the orthopedic surgeon or your primary care provider about is whether to get into like a lymphedema clinic where there's massage therapy and some other types of compressions that can be placed on the leg to try and help deal with the edema and the swelling. I wouldn't necessarily recommend initiating any compression stockings or wraps on your own because there can be some other issues related to blood clots and other types of problems that you'd want to make sure that that's checked out first. But I think certainly talk with your orthopedic surgeon or your primary care provider, and there are certainly some options in that setting.
All right, very good points. Linda is next with Docs on Call. You're live on the air. What's your question, Linda? Linda, go ahead. What's your question?
Yes, I was wondering, I have a lot of heart disease in my family. And I was wondering, I'm 64 years old, and I'm overweight, and I had a stress test last year, and it came out perfect. And I was wondering, how many years do we wait to have another stress test?
How often should she be doing that? If she's got a family history and she's overweight?
Once again, a lot of what we're going to tell you tonight keys on being seen regularly by your primary care physician. Without symptoms, I would say that at least annually, after you have had an intervention, you need to have a stress test. But particularly if you start to have symptoms of shortness of breath or heaviness or fullness in the center part of your chest, you should maybe have one even more frequently. But once again, I think the key is to make sure that someone that's very skilled at interpreting these symptoms is seeing you on a regular basis. Most people who have an intervention are being seen by a cardiologist, and that's another key person in terms of trying to evaluate these sorts of things.
Your vascular health. Very good. We've got one person who called in says they're 48-year-old and experiencing numbness in their fingers and hands and knees to feet. 6 months in duration so far, and some coolness. Obviously, some concerns here. What do those symptoms initially tell you?
You can see a couple of different scenarios in this setting. It's interesting that they mention it's both the upper and the lower, because there is an entity called Raynaud's syndrome, which is a type of spasming that you can get in the blood vessels. It's typically brought on by cold exposure, sometimes vibratory exposure, and you can get numbness, tingling, actually coldness and color changes, and it's typically in the hands and the feet. Is one of the common scenarios. There's also another entity called Berger's disease, which we see more commonly in smokers, which the smoking actually exacerbates the spasming of the blood vessels. If it's a Berger's type problem, the good news is those patients almost 100% of the time, if they quit smoking, do fine. Their long-term outlook is horrible if they don't quit smoking, but if they quit smoking, almost 100% they do very well. But it could be one of these other types of vasospastic disorders that they're having.
Go see your doctor. That's what it boils down to, right? Let's see what Sue has to say. Sue, you are live with Docs on Call. What's your question?
Hi there. I've had a problem with blood clots in my left leg, iliofemoral vein. It's kind of been an ongoing problem, and I've taken Coumadin for years, but I've been off of it for about 5 years. But I have pain and swelling, lots of pain and swelling in my groin and my calf, and not able to do a lot of walking. And I'm just wondering if there's anything that can be done about that, or if I just have to live with it.
All right, Dr. Williams, what do you think?
Blood clots in females, particularly young females, immediately make you worry about whether they're on birth control, whether they smoke, whether there's a family history, particularly amongst the females, the siblings, parents, for recurring blood clots. There can be several states that we call hypercoagulable states, whereas people, particularly on the venous side of the circulation, are prone to have blood clots. We are seeing an increasing number of young people who are on oral contraceptives who present with...
Wait, I thought oral contraceptives were supposed to be very safe.
Well, they are. There are a certain subset of people, particularly young men and women, but in this case we're talking about females, who have a thing that's called a hypercoagulable state. That is, they are prone, because of genetics, to have their blood clot very easily. And there is a concern that certain kinds of oral contraceptives may actually cause that to occur more frequently.
And that's why it's so important that you talk to your general practitioner, your OBGYN, when you're talking about these issues, so they know that family history and they can make a good recommendation for you.